An assessment of walking mobility is one of the most comprehensive gait and biomechanical exams that you can experience. Our pedorthists are some of the best in the country and take pride in giving you a thorough examination. A pedorthic assessment of walking mobility takes about an hour and involves several steps.
Hi Leanne, I'm Jennifer. I'll be doing your assessment today. I see.
Step 1 involves taking a thorough history, during which the pedorthist will ask you questions regarding your past health, your family history, and your occupational demands with respect to your feet and legs. We also ask you about your sport and leisure activities and other questions that may be relevant to your particular case. We use the latest in technology to collect all the relevant data using a cutting-edge patient record system and an iPad during your assessment. The next step is a comprehensive postural examination. In this exam, the pedorthist will take note of all aspects of your posture, from your head down to your toes. They will be looking at your head, shoulders, hips, knees, ankles, and feet. At this point, skin, structural, or alignment issues or abnormalities may be discovered. We're looking for things like whether one shoulder is higher than the other, if your pelvis is aligned, and if your knees are straight. We'll evaluate the height of your arch and other relevant issues. Next, the pedorthist will take you through some specific measurements and testing. We're evaluating the range of motion of your joints to see if they are within normal parameters and doing specific testing that may be important to your case. For example, measurement of your legs for potential leg length discrepancy. The next step involves analysis of your gait, or in other words, how you walk or in some cases run. At walking mobility clinics, we use treadmills to help with proper examination. We use digital video cameras to record you walking from a variety of angles, from the front, from the side, and from behind. The video is then played back in slow motion to better examine the nuances of your gait and to evaluate any potentially problematic areas. Your pedorthist will then take the time to explain their findings and provide feedback on exactly what is occurring in your specific case. We are always ready to answer any questions that you may have. Next, if it has been prescribed by your doctor and recommended by your pedorthist, you may be casted for custom foot orthotics. At walking mobility clinics, we use a wide variety of casting techniques in order to capture a three-dimensional mold of your feet. These include plaster, wax, biofoam, and in certain clinics, casting on a computer. In this case, the patient will benefit most from a traditional plaster mold. Finally, your pedorthist will make specific recommendations to help you with your future footwear choices. Various shoes are made to fit various foot types, and we can help you in finding the best match for your foot. Every walking mobility clinic carries a wide selection of appropriate footwear. Our clinic coordinators will then set up an appointment for you to pick up your orthotics and shoes, usually within a week to 10 days. Once you have received your orthotics, you will return for a follow-up appointment approximately 3 weeks later. This is to ensure that you are achieving the success that we want for you. During this appointment, your pedorthist will ensure the fit of your new orthotics to both your foot and to your footwear. Unique to walking mobility is our team approach. On staff are medical specialists with a focus on feet and legs. At your doctor's request, you may be seen by a physician right here in our office who will provide an additional medical perspective.